As you know, I think was mentioned, I'm an associate professor in the UK College of Nursing. My interests in general are tobacco and substance use disorder disparities, and ways that we can create policy and tailor our tobacco treatment programs to help vulnerable populations. And as also was mentioned, we did create a toolkit specifically for helping with communities with creating LGBTQ pride festivals. So part of the presentation will focus on that. Feel free if you would like to put questions in the chat as I go, or to come off mute and ask me any questions you have, or I can also take questions at the end. So I'm going to talk about the link between tobacco industry targeting and LGBTQ tobacco use, subgroup disparities in tobacco use characteristics, and then also different evidence-based tobacco treatment programs or smoke and tobacco-free policies like pride festivals, LGBTQ bars, that hopefully some of these practices you all might find interesting or you would be able to integrate into your work. So I like to sometimes start presentations that are about disparities by kind of just reorienting us to how far we've come. So it's been now almost 60 years since the first US Surgeon General's report on smoking and health. And so I'm sure, as many of you all know, we've come a very long way since this time, since, you know, almost the majority of men in the United States would have been smoking. We've come a very long time since the time that we had physicians and dentists, you know, promoting cigarettes, and a very long time since, though it was in my lifetime, a very long time since you could do things like smoke cigarettes on planes. So in fact, we've come so far sometimes that I sometimes hear people asking things like, does anybody still smoke? In which I know everyone on this call doesn't have that question, but sometimes in the general public, or especially in academia, we can have a sense that the tobacco as an issue has been like largely solved, particularly in some states in the US. But I know everyone on this call knows that it's really not true, but it's that smoking is now concentrated more among more vulnerable people. So certainly Kentucky as a state is an example of that as a whole, but also, you know, people living in more rural areas, people who have, you know, mental illness or substance use disorders, people who are LGBTQ, the smoking rates, you know, remain very high. So while we certainly have made great progress, there are also groups that have been left behind. So I am going to start by giving just a little bit of context about why people who are LGBTQ smoke more than the general population. Sorry, I'm having trouble advancing my slides. Okay. So I'll get a minute just alluded back to history again. And so it's also been since 1969 since we had the Stonewall riots, which the anniversary of which are what we're commemorating with Pride each June. So it was an early LGBTQ rights movement and protest that, like I said, is commemorated each year with Pride. And so just thinking about this during Pride and remembering this, that throughout the United States, people who are LGBTQ have faced great degrees of oppression, of being, you know, not accepted within healthcare societies, within families, within various institutions in our country, like throughout the decades, which a lot of this, of course, sets up the reason why there are smoking-related disparities among LGBTQ people, not something inherent, obviously, in being LGBTQ, but rather some of these societal issues. So when we look at why it is that people who are LGBTQ who smoke more than the general population, in part, people in this group have higher rates of risk factors that, so in the general population, if you have depression and stress, if you experience trauma and victimization, if you use alcohol, you are more likely to smoke cigarettes. And so LGBTQ people experience these other risk factors at higher rates than the general population. Also, there are risk factors that are specific to LGBTQ people, and so that would be if somebody has a negative reaction, particularly by their parents or by their teachers or people at leaders at their school, things like that, to their disclosure of their sexual orientation, it increases the risk of substance use, as does feelings of internalized homophobia. And then we have environmental risk factors. And so we have Stonewall again, just as a reminder. So if we think back again to, past decades, the way that people who were LGBTQ could meet each other, could organize, could advocate together, the way to find a safe space, at the safest possible space, I guess it was not always safe, was to go to bars. And then, really all the way through, the early 2000s, it remained the way to meet and socialize with other, LGBTQ people, a very prominent way. Obviously now with online technologies and things like that, it changes some, but there still is a historic and a place, in the LGBTQ community for bars. And so there's lots good about that, socializing and connecting. And then we also know that for a long time, bars were very smoky environments. Some places they still are. And then in some bars, there is also the sale of tobacco products. When I lived in California, it's very common for people to come into the bars selling cigarettes. So then also when someone is trying to quit smoking, drinking alcohol, obviously can lower their inhibitions and interfere with that. So the more prominent role of bars is another reason. But I'm going to go into more detail about the role of tobacco companies, because I think that it is, much more frequently overlooked compared to the other risk factors. So, for a long time, the tobacco companies have known or targeted the LGBTQ community for tobacco sales. And so this is it's from the tobacco industry documents housed at UCSF. So they're previously secret documents from all of the major tobacco companies. So this is from 1997. So it was well before the public health community was focused on LGBTQ people as people who might need tailored tobacco treatment services. And so back in 1997, Philip Morris has this internal memo trying to think of ways to increase sales to LGBTQ people. And this was their reason. They knew already that there was a higher instance of smoking adults, that there were more adult venues of entertainment, and that they said there was an appreciation for freedom of speech and a large number of events across the country that invite sponsors. And so for many years, the tobacco companies sponsored Pride and other types of, like the GLAAD Media Awards, things like that. And so in 1993, Philip Morris purchased ads in Genre, which was a type of gay magazine from LGBTQ press. And at the time, it was the first time that a Fortune 500 company had ever done this, had ever purchased an ad in LGBTQ press. And so the ad was very low key. It wasn't, ads like you see today, targeting our community with rainbows and very overt. And they didn't really want to call attention to this, but they did want to reach gay people who might smoke. So they ran this ad, but the editor of Genre was so excited because it was the first time such a large company had ever ran an ad that he released a press release. And so he sends it out to like the Wall Street Journal, things like this. And it ran all over the national media just to point out how unusual this was at the time. And so here's a title: Overcoming a Deep-Rooted Reluctance, More Firms Advertise to the Gay Community. This is the New York Post. It says new cigs aimed at gay smokers. Don't look now, Marlboro Man, but you've got a brand new gay partner, Philip Morris, which for years has used macho images to push tobacco products, is now pushing a cigarette to homosexuals. So it shows, back then, this wasn't a common thing where companies were targeting this segment of the population. But so the tobacco companies were very early on to do this. Again, in the beginning, they tried to be subtle. So this was a Parliament ad in the mainstream press in 1995. This is the one in Out magazine. And the only difference is the other man inserted into the picture. So they certainly weren't trying to do anything that was like very overt, but they were beginning to reach out to the LGBTQ community. Then I'm sure many of you have heard about this, but in the mid 1990s, RJ Reynolds created a new marketing plan that was targeting gay people and homeless people, the same marketing campaign. This is because in San Francisco at the time, what was considered the gay neighborhood and the Tenderloin of the part of San Francisco where there are many people experiencing homelessness, they're geographically contiguous. And many people who were LGBTQ at the time were sometimes experiencing unstable housing as well. So they had this campaign and they called it Project Scum, and it stands for Subculture Urban Marketing. And they were marketing cigarettes to these groups. And so as you can see now, this is a CDC ad. It's something that people bring up now to sort of highlight that the tobacco companies had this behavior back in the 90s. So here are just a couple of more images from the 90s, early 2000s. Then, moving into the 2000s, it does become more overt. This is a Lucky Strike ad that says, I choose. In 2005, if some of you all might remember, this was during the marriage. There were lots of marriage equality ballots going on all around the states to prohibit same-sex marriage. And so this is a Natural American Spirit ad, and it says freedom to participate, to be, to disagree, to inhale, to love, to live. It's all good. So they're obviously equating like the right to marry and the right to love with the right to smoke. And then here's a 2011 Take Pride in Your Flavor. So one thing I would point out here is that it's not like the LGBTQ community is the only community that the tobacco companies have done this with, where they're doing exploitative marketing. Back in 1929, actually, the American Tobacco Company was one of the first PR campaigns in our country. They did a campaign to equate women's liberation with smoking. So it was the Macy's Parade, and they had women march, in the fancy gowns, smoking, and they called it Torches of Freedom, and they equated women's liberation at that time with smoking. So it's not the first time. It's not the first time or community that the tobacco companies have done this with, but they are linking in their imagery, especially during times where there were, ongoing issues going on with LGBTQ equality policies, where they were linking freedom to, to be yourself, and to marry, to freedom to smoke. And here's an example of this is a relatively recent green smoke ad, just so you can see it. Totally appropriating. I don't even know really the link here, but they have obviously the image of Martin Luther King and the I Have a Dream. So again, Philip Morris actually was one of the first companies that had a really strong LGBTQ protection policies for their employees. So they were doing something great. Also advertising it and trying to get the loyalty of the community. And so there is some research that showed that compared to straight women, lesbian and bisexual women were more likely, at this time, it's about 10 years old, to be willing to wear tobacco industry merchandise, to have attended an event with free samples, or to own something with the tobacco industry logo. And so the other thing so I said, the tobacco companies always, throughout history have exploited marginalized groups, advertised to marginalized groups. But typically, when people find this out, it makes the community angry. It would, right? So there was an incident where, and one of the tobacco companies was targeting advertising to the Black community in Philadelphia using like community imagery, and made everybody angry when it was exposed in the press, as it would. But it's kind of the reason for reminding you of the historical context is so that this can be understood too, that there weren't other companies even willing to do this at the time with the LGBTQ community to advertise, to be reaching out and partnering with. So it was hard for LGBTQ community leaders to turn away from this. And so they did focus groups with LGBTQ community leaders and just asked them, like, how do you feel about tobacco ads in your press? And instead of feeling taken advantage of or feeling like it's a danger, they said that it made us feel like we're not invisible. It makes us happy. We're not used to that, so we're very vulnerable. And times have changed a lot now, obviously. Thankfully, made a great deal of progress in other area in LGBTQ equality issues. So now it's extraordinarily common for tobacco companies and also all types of companies to advertise to LGBTQ people, but the tobacco companies were first, and they did know really early on the vulnerabilities to smoking in this community, and they definitely exploited those. And there was a very recent article that just came out that focused on the tobacco denormalization. So it talked about views about the tobacco companies, and it was with Black African American individuals and also LGBTQ communities. And they did find that now that the more connected someone is to their community, so for LGBTQ individuals, feeling of connection to the LGBTQ community was associated with more of a tobacco denormalization belief or feelings of anti-industry. So it could be that things like pride and bringing your materials there and things like this to places where you can foster. There's also fostering of an LGBTQ community could be helpful. And then, as we transition a little bit, another risk factor is a lack of LGBTQ friendly or competent healthcare providers. Also, this is changing rapidly, but then at the same time, I'm sure some of you all might have heard about some of the recent policy that passed in the last legislative session, actually, limiting this again in Kentucky for people who identify as transgender, otherwise gender nonconforming. So whenever people don't feel comfortable going to the doctor, obviously they have less of an opportunity to interact with someone who might talk to them about smoking or help them quit. So just to show you a few statistics, there was a pretty large study done among people who identified as either transgender or gender nonconforming, and 1 in 3 people had said that they delayed or avoided preventive health care because they were afraid of the healthcare provider discrimination. About 1 in 3 also reported being uncomfortable discussing their health needs with their regular doctor, meaning the doctor that they went to already. And more than one, just a little bit over 1 in 2 were uncomfortable discussing their health needs with an unknown doctor. So you can see that particularly now for people who are, like I said, transgender or gender nonconforming, being comfortable going to the doctor is probably now going to be even more of an issue in Kentucky following recent legislation. But there's research that does show that a relationship with a trusted healthcare provider could facilitate tobacco treatment success. We just have to find ways to do this for everyone. So just a little bit about subgroup differences. So in general, people who are LGBT adults are about twice as likely to use e-cigarettes, little cigars. A lot of the tobacco related disparities are especially among youth, are more prominent among females compared to males. And so women who identify as bisexual are the most likely to use tobacco products. And then we know that people who identify as either transgender or gender nonconforming are the most likely to use cigarettes compared to LGBT adults and also to heterosexual adults. And so this image comes out of our toolkit, but we were just wanting to sort of demonstrate. So if you look across the United States, 1 in every 7 adults smoke cigarettes. Well, that's compared to 1 in every 5 among people who are lesbian, gay, or bisexual, but it's 1 in every 3 when we talk about people who are transgender or gender nonconforming. So there are also some campaigns where their groups are actually targeting subgroups of our community. So this is one from the California Smokers Helpline, which is a campaign. They did a campaign, We Breathe, that was focused on supporting tobacco-free LGBTQ communities. And they ran ads, around Pride, saying things like quitting tobacco can lower the risk of complications during gender affirming surgeries. So, always not smoking, of course, I'm sure not smoking helps with wound healing, with any type of surgery. And then also, if you are a person who's taking exogenous estrogen and smoking, you would be more likely to have blood clots or heart attacks or things like that. So there are risks to smoking that would be specific to subgroups of the community. Another subgroup that faces some different burdens would be people who are also HIV positive. So this was an ad from the Center for Black Health and Equity, and they put out ads that said, smoking while positive. What are you waiting for? Nearly 40% of people living with HIV are smokers, but smoking limits how well HIV meds work, and that should be a deal breaker. So there are ways to message around other LGBTQ health issues the importance of smoking cessation. And then I could just talk a little bit about some evidence-based strategies for tobacco treatment and tobacco policy. And so if you are providing tobacco cessation in the places where you work, you can do some evidence-based things to create a welcoming and supportive environment. One evidence-based thing people have long suggested is to have inclusive waiting rooms in common areas where there are brochures or literature. If you have that in your waiting room that are specific to LGBTQ people, it helps people feel welcome. And then a suggestion some people have is if you have like a patient bill of rights or something like that hangs like in your health department or in your clinic, that it specifically mention being affirming to LGBTQ communities. And there's a question about access to some of the ads being shown. I can follow up and send out several of those ads. They do come through something like the CDC. And so, yes, you could take them and share them on social media. So I'm happy to share the link to those. Another thing you could think about for your space would be gender neutral restrooms. So a gender neutral bathroom is obviously a way to, one, provide a safe place for anyone who comes to your facility to be able to access a bathroom, but also it obviously sends a statement as well of your support for people who are transgender or gender nonconforming. And then another thing to think about, if you have intake forms for your tobacco cessation or, wherever you're doing your work, is to make it easier for people to disclose their sexual orientation and gender identity. There's evidence showing that being able to be out about your sexual orientation and gender identity makes it easier for your healthcare providers to tailor services to you, but also people feel more comfortable. There are studies showing that when people are able to be out to the people who are helping them, that they have a better helping relationship. And so it's nice when you can make that easy. You also don't want people to feel uncomfortable, because if your forms, for example, only have options for male, female, or only have options for he, she pronouns, then, obviously some people don't fit that binary, and then, they would feel less comfortable in your space. And another thing, of course, is, the disclosure in interactions of, sharing your, preferred name or pronouns, and, asking people theirs. This is just another example of an evidence-based way to ask questions like gender. So instead of asking if someone's male or female, to be more inclusive in your options. So asking someone what they think of themselves as, and providing a more comprehensive list, and then also what sex that they were assigned on their original birth certificate. And then, also when you're collecting, if you can collect information on sexual orientation, it can also, like I said, there's research that shows that when people are out in their healthcare space and their providers are aware and able to tailor their care and, understand their family dynamics, that people have better outcomes. So again, just to show you, this also comes from We Breathe, from the group in California that was supporting tobacco-free LGBTQ communities, that, there are plenty of places that advertise, their quit line as being LGBTQ affirming. So it's just a way to, make an overt statement that the practice where you work is friendly. And then so this is an example of taking your existing resources and advertising it to the LGBTQ community. So like I said, that's great. It's showing people that they're welcome. And then there are also some campaigns that are very specific for the LGBTQ community. And so this is the Bradbury Sullivan LGBT Community Center. It's in the greater Lehigh Valley. It's in the Northeast, and their community center does a lot of work on tobacco issues. Actually, I would say that they're a leader in the country of really focusing on this in their community center, and they put out ads. So here, this ad is clearly targeting, obviously reaching out to the LGBTQ community. We have Living Proudly, Living Longer, and the Quit Now. This is another ad from that same group in southeastern Pennsylvania, the Bradbury Sullivan LGBT Community Center. Their information is all online too. And so, here they're, again, Take Pride, Quit Together, advertising their quit line. And here's another one I'll show you, just because it's one of the only ones I found that was LGBTQ specific, but also did include something specific about vaping. So you can get help to quit smoking and vaping. And these are all Pride advertisements. So yes, as someone had mentioned in the chat, if you have social media, obviously June is Pride Month. And so it could be a great time to have some positive ads focusing around taking pride in yourself and your community and your health, and getting free tailored services. This is This Free Life. So this was a national campaign, and they based it on lots and lots of data collected with the community of focus groups, and they're very positive. And so that's the This Free Life. The tagline is freedom to be tobacco free. And so just as an example, this one says, every step gets us closer to a world in full color, but tobacco can get in our way. Smoking cigarettes can damage nearly every part of our bodies. Let's live in full color. Let's live tobacco free. So they're celebrating like the progress that's been made, in LGBTQ rights, and then also throughout the campaign, suggesting that, a next step be to go tobacco free. And finally, I will talk just a little bit about the tobacco-free Pride festivals. The Lexington, Kentucky had a tobacco-free Pride festival, so it is possible in Kentucky also. But they've been happening, around the country as well, for many years. And actually there was a tobacco-free Pride toolkit, an older one from California that's great, and it was created in around 2010, and we had the idea originally, and thanks to KDPH for funding it, we wanted to create a toolkit, which we have now, specifically for Kentucky communities. And so we did that through going to Pride festivals, surveying people who were there, using images from Kentucky and being more Kentucky specific, and we were creating it to go in conjunction with Lexington having their first tobacco-free Pride festival in 2020. But as of course you all know, there were no Pride festivals in 2020, but that was our original plan. So this is what the toolkit looks like. You can access it on the Breathe website. But if you are in a community that has a Pride festival, there are many in Kentucky. Sometimes they look a little bit different. They might be picnics or, days at the park for some of our more rural communities, but there are more than you might realize, in our state. And so we have created this guidance that we tailored, in Lexington. And the toolkit itself was created, like I said, with input from our community here in Kentucky. So Kentucky Pride attendees, but also we interviewed LGBTQ advocates who had successfully implemented tobacco-free Pride festivals across the nation. And then we talked to local LGBTQ leaders. And we also didn't reinvent the wheel. We looked at the 3Ts model for tobacco-free college campus policies that Dr. Ellen Hahn created. We looked at that, older toolkit I was telling you about, and we also looked at some of the scripting from UK's tobacco-free Take Action. So hopefully some of these are things you're already familiar with, but just to show you a little bit about what's in the toolkit, which is hopefully helpful to you all. These are some Pride attendees in Kentucky, and they said, smoke-free Pride events can create a safe and healthy environment for everyone. The idea that everyone has the right to breathe clean air and enjoy the Pride event. When there's secondhand smoke, it creates a barrier for people with HIV, heart disease, people with lung disease, and people who bring their children. And so again, all these images are people who even could be potentially recognizable if you are a member of this community. And so this is just another example of the whole, it's meant to be very user-friendly. So we had some people who were sharing with us the reason that they did not want, that they were scared for their Pride festival to go smoke free is because it's a fundraiser. It is a major fundraiser, at least in years past for Lexington. It was the fundraiser that keeps the entire center open. So it's a huge problem if there's a reality or a perception that going tobacco free would hurt that. So we tried to we asked about these concerns to the people who had done it successfully in other places and tried to create tips to help get around this. And so This one was be prepared to understand and help address common concerns like financial concerns. So a tobacco-free advocate in another state said, understand that these are almost all volunteer-run festivals. They're very reliant on ticket sales. If they make a big change and they lose their ticket revenue, they can't continue the festival. And in some cities, they can't even keep their center open. We don't need to, this person said, we don't need to persuade them, talking about the festival board, as much as we need to demonstrate that it won't harm the festival. They all want it to be smoke free if they can make it happen, but they're concerned that they can't. And that's where you would need to come in and say, we'll work with you and help you make it happen. And so there were some considerations like distributing a petition at LGBTQ events to demonstrate, that people, other attendees' interest in tobacco-free. You could ask local LGBTQ-owned or friendly businesses to sign a letter of support, or you could highlight successful tobacco-free pride festivals in other communities. This is just another example from the toolkit. So we also looked at the 3 T's model, like I said, that Dr. Hahn created related to tobacco-free campus policies, where you would tell, treat, and train. So you have to clearly communicate with the stakeholders to spread the word before the event. That would be the best, that it's on your advertising and things ahead of time so that it's not a surprise to somebody when they show up at the festival that there's tobacco-free grounds. That's similar to a university policy, right? Where you tell people long in advance of going smoke-free. In a really best case scenario, you could provide tobacco treatment right on site at the event. There are, at least at the larger pride events, there's often is a health department participation. There's very often at pride festivals, things like HIV testing. So would not be unheard of to provide, there's Narcan distribution for overdose prevention. So there's a venue or a recognition that there would be wellness types of activities at these events. But if you can't do that, you could potentially partner with a university. So this would be for advocates who are telling them if they can't do it themselves, perhaps they could reach out to a health department or a university and bring somebody in. We did talk to a group of advocates who signed people up for the quit line. So they entered that data and did those referrals, the next day. So there's different ways to do that depending on their resources. And then you have to train the volunteers and event staff about how to respond, to policy violations, because this is obviously, that is kind of obviously, I think what people worry about the most is like what happens and you don't want to, be policing the event and it's a positive event and things like that. And so, which is true. And so these are just some thoughts from advocates on how they do that. So for TEL, these advocates said, at the events, we produce signage that's throughout the entire festival. It says, welcome to our smoke-free pride. At the festival, the team is out in force, putting LGBT smoke-free stickers on people. They gave out 3,000 to 5,000 stickers. And so another person said, I got them, the pride board, to pledge to go smoke-free and allow me to provide signage. We had signs in the front. We had signs as people were coming in. There were signs at the beer booth, signs at the porta potties. There was signage everywhere. And for the most part, it's just respected. In terms of treat, again, you could have this on site. You could do referrals to a quit line, or you can just pass out the quit line information if that was all you could do. And this person said, one of the main things we do is consultations. We try to get people connected to the quit line if they want to. We had more quit line referrals during that Saturday, the Pride Festival, than we do throughout the whole year. We have the form there and they fill it out. And when we get back to the office on Monday, we fax them in. And then train. We know that people said they had to train their festival staff, which again, remember, is volunteer usually, what to do. And so again, it's not a policing thing. You're not, out there issuing fines, but so it's just a script of, hello, my name is, and I am, a staff, a volunteer with the Pride Festival. For the health of our community, our grounds are tobacco-free. We ask that you please respect the policy and put out your cigarette. So, and then this is when we've talked to advocates, it's the stickiest part, it's the hardest part, it's the part that makes everybody feel the most uncomfortable. So we just felt like if people could practice and, see that it's not meant to be confrontational or difficult or anything, or, not meant to make the Pride Festival not a warm and welcoming environment, people can get more comfortable with this. So there's the scripting, the link for more information on the scripting. And these are just acknowledgments for the toolkit. So the funding was provided by the Kentucky Department for Public Health. We had expert consultation from KCSP and the Americans for Non-Smokers' Rights. And so someone put the link to the toolkit is in the chat. So if anyone is wanting to do something similar, I hope it's helpful. Can you expand on offering tobacco treatment at events? Sure. So we talked to people when we did our interviews from around the country. And so we were interviewing people who are tobacco advocates about what they did. And they really did a wide range of things. And so the ones who had the resources and the partnership and ability, they could bring somebody in from the health department, for example. So if they already had a van from the health department there and they would have, somebody, doing HIV screening, then they could have somebody who could distribute nicotine replacement products for the day of, or they could have someone who could do a full, in the van, like tobacco treatment consultation. But a lot of times people did not have those resources. And so they were doing more, like we were saying, the facilitated referrals to the quit line, like somebody will, call you next week. So it really would vary depending on the partner that an organization could get and the funding.
There was a question earlier. I don't know if you answered it or not, but it might be worth mentioning again. Someone asked if the ads to those, or the ads that you had in your presentation, is there anywhere that those can be accessed, or those in your toolkit?
So I did answer as we went along, but I'm
Okay.
happy to answer it again. So I can send those to you, the links for where they are. Okay. Most of them were created in part by the CDC or the FDA or something, and so they would be publicly available. And it's a great idea if you have a social media, because it's Pride Month, so it would be a good time to use those.
Awesome. Thank you very much.
Okay. If you guys have any questions, feel free to put them in the chat or in the question and answer box. They're on here, and we can answer those. Trying to go through some of the ones that we have already. Are the e-cigarette and vape companies targeting the LGBT plus community just as strongly as the cigarette companies did in the beginning?
So I can say that, so in part, we don't have access, unfortunately, to the tobacco documents, to look at like the exact ways like we did, but certainly there have been some papers published on the e-cigarette companies using very similar tactics, reaching out to the LGBTQ and also other vulnerable populations. And you don't see, you're not going to see, really much anymore, like an actual cigarette sponsor of a Pride event. But in very recent years, at least in Louisville and Lexington, you could see people selling e-cigarettes on site. There would be more than one, booth dedicated specifically to the sale of e-cigarettes in Lexington. But the Lexington Pride Festival, which I think was very progressive in doing this and wanting to do it, they have prohibited that as well. So it's up to the Pride Festival if they allow the sales and advertising of the products at the actual festival.
Great. And then kind of a difficult question, but how can we interfere politically palatable?
I don't know if it's me or you, but you were breaking up and I couldn't hear the question.
Okay, it's probably me. So Curtis.
I can take care of it. How can organizations be LGBTQ plus friendly in areas where it is not so politically palatable?
Well, I'm not sure if the question means like if the administration or leadership of your organization isn't supportive, or if so I would say there are best practices. There are national best practices on things like your forms, like when you're asking someone's gender identity and sexual orientation, that you're doing that. So I think that you could explain to your leadership or to your administration that it's not really a political issue. It would be about providing tailored best practice care in terms of things like that. I understand that it may be difficult, and it may take time if you work in an organization that has a large administration, maybe, or like a university or things like that. It's hard to sort of move the needle, but I think being able to focus on that it's evidence-based care would hopefully be able to be helpful.
Great. And then can you possibly share with us, so we can share with everyone else, a link to those best practices? Would you be able to do that? Great, thank
Sure.
you. And we did have a question in the Q&A box. Gary Hall from the Green River District asked, where can we receive data on the LGBTQ plus youth and which nicotine delivery systems they use? How do we help move any strong identity with nicotine use?
So there's data at the national level, but actually, and I see that Elizabeth is on the call, and she might be able to speak more to it even than me, because she's provided this data to me before. But at the state level, also our YRBS and our BRFSS data does, for several years now, has asked questions about sexual orientation and gender identity. And so you can look, even in Kentucky specific, and even in, rural areas, things like that. I see Elizabeth's coming off mute, so I'm just going to turn over to her because she knows.
I mean, I'm not necessarily the huge expert here, but yes, the Youth Risk Behavior Survey, I'm going to say for 3 or 4 iterations, has asked questions about sexual orientation, as well as maybe activity is not the correct word, because of course not every teenager is out there living the wildlife, but they do ask identity versus behavior, because you do have a subset of population where they don't identify as LGBTQ, but they, it's like why we talk about men who have sex with men. So that has been available for the past couple of years with the YRBS, and if you can't find the exact data set that you're looking for on the Kentucky Department of Education website, you can contact Stephanie Bungie or Jim Talbert, and they can help you get that data more broken down if you need it. I will say this past legislative session with Senate Bill 150, it says that any health survey, you need an opt-in protocol from parents, and the questions need to be available to the parents before the survey goes out. And there's also some question about what types of questions can you ask to be in compliance with Senate Bill 150. There are, of course, all sorts of lawsuits happening and being planned, so we don't know where that's going to be by the time the YRBS comes around again, but getting that type of information might be a little bit more difficult in the future. But I will say, if you look at the data that's available for the past couple of years, we do see higher rates of tobacco use among our LGBTQ youth, for all of the reasons that Amanda has mentioned.
I think if nobody else has any questions, I think we could begin to wrap up. Dr. Fallin-Bennett, thank you so much for being here with us today. Your presentation was great. I know I learned a lot. I'm sure everybody else did too. I dropped a link for the evaluation of today's presentation in the chat. If you could take just a couple of minutes to fill that out for us, they are incredibly helpful. We use them month to month and at the end of every year to shape how we do things here for these coordinator calls.
Thank you all. Have a nice day.